Has your doctor told you that you have high blood sugar, or do you have low blood sugar? Do you struggle with losing weight? If so, you may have what's called insulin resistance. If you've been listening to this show for a while, you may know about insulin resistance, but it is something that really affects so many areas of our body, including our hormones. And it causes a lot of people, a lot of women, to develop a condition called PCOS or polycystic ovarian syndrome, and that is something that I used to struggle with, and so did my guest today, Dr. Lilli Chappell. Lilli is the CEO and founder of the company Lilli Health, which seeks to revolutionize the treatment of PCOS in women. She's a registered dietitian. She has a Master of Science in Nutritional Sciences, and she also has a PhD. So she is a real wealth of knowledge in this area. She's also done several clinical studies testing the effects of different dietary strategies on insulin resistance. And in today's episode, she is going to share the results of those studies, which are phenomenal. They have really, really great takeaway messages, and you are going to learn so much about how to eat to help your insulin levels, because insulin resistance is something that affects more than 93% of the population. That's what recent studies are showing, which is really, really alarming. So in this episode today, you're going to learn so much about how to eat to optimize your insulin levels. I hope you love this episode with Dr. Lilli Chappell. All right, Lilli, I am so excited to welcome you to the Unlock the Sugar Shackles podcast. Thanks for being here.
Thanks for having me.
I saw your content it was some sort of, the Instagram gods were working for me. I saw something that you posted on I was in the comment section, like no one should ever be in the comment section on Instagram, I feel like. But I saw something that you wrote and I was like, she knows things. And so I went to your page, I went to your website, I dove into all your content, and I feel like I am so excited to learn from you, and I think we have similar stories, so super excited to dive in. So why don't we start with you telling us about your story and how you came to study insulin and PCOS and everything that you do today.
Absolutely. So, oh goodness, I think my story starts at 14, really. I mean, that was really when I started noticing weight gain, and it would not go away. I did everything. I mean, that's really when I feel like a pretty bad eating disorder started, because I was doing everything, waking up in the middle of the night to sneak workout on the treadmill, all the things. Tried everything, weight kept going up. After I graduated high school, I was a foreign exchange student in Brazil. I lived there for a year, and I gained about 30 pounds. And I still worked out every day. I didn't have a period the whole year. And so I missed this part. So when I was in high school, I didn't start my period until I was 16. And every year I would go, and my mom would be concerned because I had one period every 6 to 12 months. So I'd get an ultrasound. They'd say, you have cysts on your ovaries, but it's okay. Cysts are normal. You're fine. Also, I had terrible acne. I was on Accutane twice. So I don't even know if they still prescribe Accutane, but I was on it twice. That's how pretty severe my acne was back then. So then I went to Brazil again, did a foreign exchange, and my host mom was really concerned because I didn't have a period the entire year that I was there. And she took me to a doctor, and he asks, do you drink milk? And I was like, well, yeah, I drink milk. And he said, why don't you try not drinking milk and see if your complexion clears? And I mean, it was pretty immediate. I mean, it was amazing. It really did. I mean, I didn't cut out dairy, and I still don't cut out dairy to this day. But milk is far different, and I will talk a little bit about that later. So I came back. I was, went to school. I wanted to be a dietitian, probably because I was trying to learn some secret to weight loss that I didn't know. Followed all the things, all the whole grains and more starches and less fat and less animal protein. And needless to say, I gained more weight, was more anxious, was more all the things, worse acne, no periods. So finally, and I was 21, I go to the doctor, the on-campus health clinic, and got diagnosed with PCOS. Had never heard of it. I mean, I'm in my last year of graduating with a bachelor's in nutrition from one of the better schools in Texas, definitely the best for nutrition, and had never heard of PCOS, had really never heard of insulin resistance. Now, this was in 2008, so I'll age myself a little bit, but there was nothing about that. And so I really dove into this world of insulin and insulin resistance and realized that all the things that we've been telling patients, especially from this age-old nutrition dogma world, was just wrong. And so I learned, I really developed kind of this lifestyle approach on how do you lower insulin levels. And that kind of led me to this journey.
Amazing. I can't believe how much of your story I relate to because I also had PCOS and was struggling with acne and missing periods. And a long time ago, before this, I was having really painful periods and I got an ultrasound and they said, oh, you have a lot of cysts on your ovaries, but that's normal. And so, I never thought anything about it and I just didn't know. So what was it that made the connection for you that insulin was at the root of the PCOS? Because that took me years to figure out. And it wasn't until I heard a podcast where someone said PCOS is the diabetes of the ovaries that I started to pay attention to blood sugar and insulin. And we know that type 2 diabetes is driven by insulin resistance. It's not a problem of high blood sugar. That's a kind of a symptom of this. So what was it that made that connection for you?
I mean, I remember this is 2008. Now we had Facebook, but I don't even think there was Instagram. There was no social media where you're going out and learning this. This was simply me diving into the literature and reading every article, every publication that I could find on this topic. And there was a lot, even then. Even then, in 2008, some of these articles might have already been 10 years. So, this is not new information. We have known about insulin and insulin resistance for years. So actually about a month or two ago, I do what I call a Hail Mary pass email every once in a while where I send an email to some random, I sent an email to the director of fertility research at Columbia University, got an email back. So I sent an email to who I call the godmother of insulin resistance research. She's 75. She is professor emeritus at Boston University. She is basically she's the one that says, diabetes is it's not about blood sugar, it's about managing insulin. And why aren't we measuring insulin levels? And, insulin resistance is more about beta cell exhaustion, which is just the cells in your pancreas that's secreting insulin. They're just so overwhelmed because they're just making too much all the time with our Western diet. And so I emailed her just out of nowhere and she's like, just so happy that 30 years of research has still not translated into medicine. And she's like, I'm happy that somebody is going to take this baton and maybe one day this will become part of standard of care. But so yes, for back then it was just PubMed and finding everything I could find that was published on it. And it took a lot. I decided to get a master's degree, decided to get a PhD, and master's degree, during the whole master's program, learned nothing about PCOS, learned nothing about insulin resistance, got a PhD. I remember my last year in my PhD program, there were 8 or 9 other PhD students, and we all had to give a seminar presentation about our dissertation. And so I was presenting about my study, which was looking at an insulin lowering diet or lifestyle in PCOS patients. They hadn't even heard of PCOS. I think 8 out of 9 of them hadn't even heard of PCOS. And I'm like, you've been studying nutrition for 9 years, 4 years of undergrad, 5 years of graduate school, and you've never heard of PCOS. And so it's just...
Yeah, and this is something that more than 10% of women are currently experiencing. Do you have
20.
updates? So
20%. It's 1 in 5. Yeah, and it's depending. It's very high in South Asia and India. It's much higher than 20%. In the U.S., it might be slightly lower, but globally, it's 1 in 20. Or 20%, 1 in 5.
Yeah, so 1 in 5 women are experiencing this, and it's just, women aren't included in medical studies, they haven't been up until 1993 or something ridiculous. So it's just, we're getting overlooked. And then the information out there, we were about to talk about this offline, but wanted to save it for the podcast because you and I both related to just you had to dive into research in PubMed, and I wasn't looking at research. I didn't know how to read research, but I was sort of from the consumer aspect. I was reading blogs. I was reading books. I was on Instagram. So I started developing PCOS in 2013-ish. And so it was around 2013 that I was trying to figure out what was wrong. And I was looking at all the PCOS books and everything for PCOS. And what I would see was that it said that there's a higher chance of having like blood sugar problems or something like that. And I didn't relate to that. I'm like, I don't have diabetes. I don't have to pay attention to this. It wasn't like, hey, the high insulin is driving a lot of this problem. And so, what do you see as like a giant gap in even the current messaging in PCOS? Because this frustrates me to no end.
Absolutely. And you cut out a little there, so sorry if I'm cutting out, but I know you can cut this out later. So I didn't catch the end of that.
Oh, sure. So, what is missing in the messaging when it comes to PCOS? Like they were kind of saying like, oh, a lot of people with PCOS have blood sugar issues and like prediabetes, diabetes, or there's a higher risk of that. And in my mind, I'm saying you have it backwards. So, that the insulin issues are causing the PCOS. And that's why once I started addressing my insulin issues, I was able to get rid of the PCOS. Is this what you're seeing too? Am I understanding things correctly?
Well, I think first and foremost, the explanation of what causes PCOS. I think this is one thing that's really misunderstood. So most of the research establishment and medical establishment accept that PCOS starts in the womb. And it doesn't always mean necessarily, the womb you were in. It could also be your grandmother. So there's been studies that show that insulin resistance or high insulin levels in pregnancy can actually cause genetic changes that lead to high insulin levels for at least 3 generations. Now, they've only looked at it for up to 3 generations in mice, but they can show that exposure to high insulin levels actually causes those babies then to oversecrete insulin. So that's first and foremost. Now, the other thing when it comes to PCOS is that when you're exposed to high testosterone or anti-Müllerian hormone or other hormones that are associated with PCOS, they also have genetic changes that go on to help have them oversecrete insulin and testosterone. And so this is really what's causing PCOS. So they're really born with PCOS. It never goes away. Now, absolutely, you could put it in what I would say maybe remission. I don't have any symptoms of PCOS. My periods are 31 days on the mark. I don't have acne. I don't have, I don't have issues with PCOS anymore. But I absolutely would come back with a vengeance if I were to stop following my lifestyle. So you never really develop it or lose it. It just is part of your DNA. And so I think that's one thing that's important to know.
Now, so it's manifesting or not manifesting based on the epigenetic, like how you're living your life.
So it's epigenetic in the womb. It's in the womb, so epigenetics, based on the mom's environment. So the maternal elevated insulin or testosterone. Now, my mom is extremely fit, but she also has a few little symptoms every once in a while, but she's has to watch her weight. She's had to her entire life. Her mother, same thing. So, I just know that it's part of my DNA, and it's just something I have to do. Now, I think the messaging for PCOS around food and nutrition is what's hard. You get to these, like I said in my education to be a dietitian, I learned nothing about PCOS. In my internship to become a dietitian, you spend 9 months rotating, seeing patients, rotating hospitals, outpatient, all this. I never not one time saw a PCOS patient. In my exam to become a dietitian, there was not a single question about PCOS. So I'm always a little skeptical when I see dietitians who claim to be PCOS experts, because I am always wondering, maybe your program had that and mine didn't. But I had to get a PhD in, reproductive endocrinology to fully understand the grasp. So I think the messaging out there is that, you can eat whatever you want and moderation is everything. And I wish that was the case. I really wish it was. But unfortunately, we are just a different breed with a different genetics. And once I got my head wrapped around what I'm going to have to do to live my life in a healthy way, it didn't become that difficult anymore. And so I still see plenty of influencers who look, in great shape on Instagram, who obviously don't have PCOS, eating all the oats and the things and the beans, and they look great. And I just want to say that something can be a nutritious food, having high levels of nutrients, but that doesn't mean it's a good option for you if you have PCOS or insulin resistance. And I think that's what the messaging needs to be.
Yes, it is so refreshing to hear you say that. And that is the exact type of messaging that I like to share, that just because a food is healthy on paper, that it has nutrient density and that it's a whole food, it doesn't always by default mean that that food is perfect for everyone. And it's I spoke with someone, Michelle Shapiro, she's also an RD who I love her messaging, and she talks about that it's really a luxury to be able to eat in moderation and eat everything. It's like you not everyone can eat in moderation because a lot of us are healing from chronic illnesses, or these chronic illnesses will return if we eat in moderation, because now the food landscape in this 21st century is so different than the food landscape that our ancestors grew up in. And so it's just, we're not talking about the same thing. Like, who can honestly eat ultra processed foods in moderation, which is a term that doesn't mean anything, and be extremely healthy? I think you're going to find that there's a really, really small number of people who can do that. And so it's, yeah, the messaging that RDs specifically are taught in school is very hard for me to hear because it just doesn't, yeah. And as you don't use that messaging because you know it doesn't work for people who have chronic issues. Yeah.
Some people for sure, they don't have, I mean, I always use this example because I get questions like, well, you know, East Asian patients, populations, they eat tons of rice and they're so lean. And I say, well, first, let me remind you that, and a lot of people don't realize this, East Asian populations, like Japan, China, East Asian populations tend to undersecrete insulin. They don't secrete enough insulin. They tend to have insufficiency, which is why type 2 diabetes is extremely common in those countries. Now, people don't realize their type 2 diabetes rate is so high because they also look so lean and healthy, but they have extremely high rates of type 2 diabetes. But here's why. If you don't make enough insulin to keep up with your rice-heavy diet, you're going to have blood sugars that rise. If you don't make enough insulin, you're going to have diabetes. But you're also going to be thinner. You know, people don't realize high insulin levels cause inflammation, which can attack the collagen in your skin. So a lot of times, you know, they do have a lot of, you know, staying out of the sun and why their skin looks so great. But it's also because they generally just have less chronic inflammation because they're not insulin resistant. So, you know, that's, I think, you have to realize you don't have the same genetics. So you can't necessarily compare, like, you know, apples to eggs there. Like, that's very, very different. And yeah. And the other thing I would say is that even when it's not like really processed food, like I like to use two examples. One is corn on the cob. You know, corn on the cob, the ancestor of corn on the cob is actually called teosinte. Now, teosinte was 2 inches length. It had like 10 corn kernels on it. And that it had this like super protective coating that you couldn't even eat it. And now corn on the cob is like this big and it has like 300 kernels, and that old protective covering is now like that really thin sheet that gets stuck in your braces. I mean, so we're talking about two very different foods that has been completely, not just genetically modified, but just, you know, modified over thousands of years. And the same thing with wheat. Like wheat it had like, oh, you should see pictures of what wheatgrass looked like versus now wheat, which is so different because, again, it was meant to feed tons of people. So they didn't have to spend all their time hunting and gathering. They could just, you know, eat their stored wheat and like build societies. Yes, our society was built on starches, and that's great. But now we're not living that same lifestyle. So I think that's one of the things I say is we were never evolved to eat so much starch. I mean, just the amount of glucose and starch that we are just constantly bombarding our bodies with is just not what was ever wildly available to any generation, to previous generations.
Not biologically appropriate for a human being, right?
Right.
Yeah.
Yes.
So let's back up and dive into what is insulin resistance, because we hear this term a lot. It's like, there's insulin resistance is on the rise. Like 93% of people have metabolic issues. What is insulin resistance? Walk us through this in a way that the average listener can understand.
Okay, so insulin resistance is first I'll just say there's been a debate for quite a few years as to whether eating foods that raise insulin levels cause insulin resistance, or does insulin resistance cause high insulin levels? And I think that that's a really important way to start. So I did this post once, and I'm going to kind of talk it through it. So it was me holding an apple, and I had some golf tees in the apple. Okay, and I said, this is a cell, and these golf tees are your insulin receptors. So what happens is insulin binds to one of these cells to let glucose through. But when you have foods that you're eating too much, that are secreting too much insulin, all these little golf tees basically your cells get overwhelmed. So what happens is it starts pulling those receptors off the cell. Well, if your cell doesn't have those receptors, then glucose can't get in the blood. Well, so then your pancreas says, oh wait, there's too much glucose in the blood. We can't have this much glucose in the blood. It can't stay here. I'm going to make more insulin because something's going to have to get that glucose into the cell. So it does that. But the more it makes insulin, the more those cells and its receptors get overwhelmed, and they get rid of more receptors and more receptors. Does that make sense? Is that too scientific, or is that like
no, that's
helping?
Good.
Because I want to explain, it's just when your cells stop responding to insulin. But what does that actually mean? It means you're eating foods that are causing so much insulin to be secreted. The cells in your body get overwhelmed because they're like, you're throwing all this insulin at me. I don't want any more glucose. I can't take any more in. I'm going to get rid of my receptors. Like, I'm going to lock the door to my cell. And the pancreas responds by making just more. And so this is really just the vicious cycle that people live in pretty much their whole lives. I mean, especially in a baby who's born to a mom with high insulin levels. I mean, this process, they have looked at embryos from women who are insulin resistant. An embryo is 11 days of life. They're already metabolically different than an embryo from a patient who's not insulin resistant. I mean, we're talking, this starts so early. And so what happens is that they go to the doctor, their A1C and blood glucose is checked, and if it's normal, they just go on with their lives. But that's the problem with insulin resistance, is that if you're not testing insulin levels, you have no idea. So A1C essentially tells you whether your sugar has been normal over a course of 3 months, but it doesn't tell you how much insulin your poor little overworked pancreas is having to secrete to keep that blood sugar normal. And that is what's insulin resistance. So again, insulin resistance is when those cells are just overwhelmed, being bombarded with so much insulin, which then starts this terrible cycle where the pancreas oversecretes, where then more insulin makes you more hungry, makes you want to crave carbs, makes you want to take a nap. So then what you do is you eat more of the foods that make it worse, and then you just are in this terrible cycle. And so until by the time your A1C is elevated, you've had insulin resistance for 2 or 3 decades, and all it's done is cause chronic inflammation and increases risk of disease. So that's why 9 out of 10 people have it and have no idea.
Yeah, and so let's talk about the testing for it. So we are testing for A1C, we're testing fasting glucose. That's what doctors are doing this. I don't agree with the ranges they use, but they are testing it. But no one's testing insulin. No one's testing fasting insulin or looking at HOMA-IR. So can you talk about how should we test for insulin? What should we ask our doctors for? And then what ranges we should look for?
Absolutely. Well, first, why aren't doctors testing this? One, because the range they've not had standardized ranges. Again, you have some populations who don't make enough insulin. You have some populations like African American, Hispanic populations. They oversecrete insulin naturally, which is why they tend to have higher rates of chronic disease. So you have a lot of different types of people that have different insulin levels, but it doesn't change the fact that there's a pretty good established window in the literature as to what a fasting insulin should be. And that's between 3 and 8. So 3 to 8, the 3 is kind of iffy again, but 8 is pretty solid. I mean, some people say even lower, but an 8 really is where they found long-term is a good predictor of whether you're going to develop chronic disease. Anything over 8. But why? The other reasons why they're not is because, one, it's really kind of a pain, right? You have to have patients have to be fasting. So in A1C, you don't have to be fasting. That's why they tend to do that a lot more often. But with fasting insulin, you have to be fasting. And fasting in a 2-hour insulin is even better. Basically, that says you're coming in at fasting. We're going to take your insulin. You're going to drink this really high sugar drink. You're you're going to wait 2 hours, and then we're going to see how much insulin you're secreting after eating. That's even a better one, but not everybody has time to sit at a lab for 2 hours in the morning before they, even eat breakfast. So both of those are really important reasons. And then the third is just insurance doesn't always reimburse or cover insulin testing in people who don't have elevated A1C. It's backwards, but that's just where we are in today's medical, standard of care. So that's why they don't test it. But the ways that you would test it if you went to the doctor is you would say, I want a fasting insulin run. Or you also could ask, I want an oral glucose tolerance test with insulin. This is basically drinking the sugar, waiting 2 hours. It's the absolute best overview of your metabolic health. Like, in fact, if those are normal, nothing else matters. Your triglycerides don't matter, because if that's normal, then you already know that everything else is normal. I mean, high cholesterol is related to insulin resistance. High triglycerides related to insulin resistance. Obviously, A1C. So, I mean, if that's normal, you can pretty much skip all the other exams. Like, that's it.
Amazing. Super helpful. I've always used the range like about a 2 to a 5. So I guess that's a little bit more specific, but let's talk about that low range. What would make someone have low fasting insulin? And obviously, I'm sure type 1 diabetics fall in there because they're not making insulin. But what about someone who's coming in at like these lower numbers? What could that indicate?
Well, they could be East Asian, right? Mm-hmm. Where they have just their pancreas just doesn't make enough insulin. That's one. One could be they fasted for too long prior to their test. So usually you don't want to fast for longer than 8 to 10 hours. So that could be one. They could be a very strict keto. These are some of those levels. And then the fourth one is some patients. Well, so I have this in my book. I call it like 3 different ways that you have diabetes. And this one's called the retired pancreas, where you have that poor pancreas has worked so hard its whole life that it's just done and it stops making any insulin. So that is another reason why somebody who has low insulin but high blood sugar is because of that reason. So there are a couple of different reasons why somebody might have too low, but it doesn't always necessarily mean it's a bad thing unless their blood sugar is high. And that's really the bigger issue. If their blood sugar high and their insulin is too low, it means something's wrong with their pancreas.
Got it. My insulin is low, and my blood sugar tends to be low. So yeah. I don't know.
But you probably do keto. Are you a keto?
I mean, okay. I did keto for a while, and I'm pretty low carb. I cycle in carbs, and yeah, so it's maybe just over time, it's just my body's not really making too much insulin because it knows it doesn't need a ton of it. But yeah.
But here's the other thing, and this is the other reason why I do recommend the fasting and the 2 hours. So when you're young, your liver's pretty good at clearing out that excess insulin. Okay, so even if you, I've known pretty overweight people who I would have said 100% had an abnormal fasting insulin, and they came back with a fairly normal one. And that's because they're young and their liver was still able to clear it out. That's the reason why then you do the fasting and the 2 hour, and it tells you how much you're over secreting. I mean, I have PCOS, so I'm definitely an over secreter. I'm naturally going to over secrete insulin because that's just my genetics. But, and I know that I do, especially like just my 2 hour glucose is in the 50s. That means I'm secreting so much insulin. It's driving down my blood sugar. And so that's, I think that's another reason to look, especially if you have PCOS and you have a normal fasting, you do that 2 hour insulin and you're going to find out pretty quickly how your body's responding to too much glucose.
Interesting. So this is manifesting that over secretion of insulin. For a lot of people, I see they have reactive hypoglycemia, and that's what you just talked about, which is where your blood sugar crashes after a meal. So what causes that? What causes you to be an over secreter? And then if it's just genetics, then how can we sort of work with diet to help that piece?
So yes, so what happens is, again, you are an over secreter. Predominantly, this is people who are insulin resistant. So they're secreting so much insulin and it's driving that blood sugar down. Sometimes immediately, sometimes over time. But what happens is then they're hungry, they're tired, obviously. The sorry, second part of your question was what we can do about it. The best thing to do about it is that if you lower insulin levels, if we go back to our apple one, the analogy. So you have your apple, you have your cells, you're eating foods like rice. It's causing tons of insulin to be secreted. It's binding those receptors. It's internalizing those receptors. The pancreas is secreting more. The best way to do this is if you start avoiding those foods that are over secreting insulin and you're not bombarding it, you're lowering your insulin levels. When you lower your insulin levels, they're able to work better and your body doesn't have to secrete so much. I mean, so really everything starts with your insulin because that's really, everything else is a symptom of that, if that makes sense.
Yeah, no, that makes so much sense, and that's really helpful. And so I work with people to help them make I call it like a blood sugar stabilizing plate, and it has a lot of protein and fat, and then we work towards lowering the carbohydrate content. And so there hasn't been a distinction that I've made up until I saw your posts. But tell us, I guess, what would be helpful now is kind of figuring out what are the foods that raise insulin the most?
Well, I think they're obviously carbs. I mean, carbs do raise insulin, but carbs are not all the same. And I think that's important to distinguish. And not even just talking about processed or unprocessed. For example, starches are the only carbohydrate source that are 100% glucose versus fruit, which is part fructose, part glucose. Now, I know fructose has a bad name, but we have to completely separate high fructose corn syrup with fructose and fruit. I mean, it's a very different thing. Like, for example, a normal size apple has about 5 grams of fructose versus, high fructose corn syrup, 100 grams is 55 grams. I mean, these are very different numbers. So it's very, I do definitely like to separate those out. But when it comes to what spikes insulin, obviously foods rich in glucose, things like your starchy foods, those are going to have a much higher insulin spike. For one reason is because they're all glucose. But the other reason is because when you cook starch, which you have to cook all starches to be able to eat them, it breaks up the bonds between those glucose molecules and it makes it much easier for your body to digest, which means much easier and faster for it to make it to the bloodstream and cause this insulin spike. So starches are one of those. Milk is another, and then obviously added sugar. But here's why milk raises insulin. So dairy, milk, I don't think people realize, or they realize, but sometimes they don't really remember that the whole purpose of milk in nature is to feed a baby and to help give antibodies, but also to support growth and to stimulate growth in a newborn baby or a newborn calf. And it does that by 2 ways. One is that milk has naturally occurring insulin and insulin growth factor in the milk. That helps to raise blood levels of insulin and IGF-1 in the baby, which IGF-1 is this very, very potent growth hormone. I mean, a baby triples its length and doubles its weight in the year. And it doesn't do that because it's eating a lot of calories. It does that because milk stimulates insulin. Insulin promotes fat and growth. The other thing is that the proteins in milk, so whey protein and casein, but predominantly whey protein, is very, very concentrated. It is the most concentrated source of branched chain amino acids, like leucine, valine. And what happens is that when you eat whey protein, it causes the pancreas to stimulate insulin. In fact, there's been studies that show that whey protein stimulates insulin more than a slice of white bread. And I think that's been replicated. And that was one of the very first studies I ever read about all of this and how I was blown away by that. And so that's the problem. So we have whey protein and we have insulin in the milk, and both of those biologically are serving to elevate insulin levels in a newborn or a newborn calf to promote fat growth and to promote length, just overall growth. Well, so now we have 9 out of 10 people who have insulin resistance and they're eating not only just whey protein, but milk 3 times a day. And so that's really the issue. Now, Greek yogurt and full-fat cheese differ from other types of dairy because they have all the whey is completely removed. Greek yogurt differs from other type of yogurt because it has all of the whey protein removed. And then also studies show that fermenting casein can reduce that branched chain amino acid content, can lower its insulin release. So that is why I'm not 100% dairy free, and I don't always recommend 100%, but I definitely don't recommend liquid milk or anything with whey. And I think that's probably the biggest surprise for so many people, because whey protein is so ubiquitous in our food supply. But it's great for helping people build muscle, but unless you're trying to lose fat, all you're doing is constantly flooding your body with insulin, which you don't need that to build muscle. You don't need that. It's like you're throwing gas on a fire. Like, you didn't need that.
Yeah, that is really helpful. So you would say starches, added sugars, it was, and milk and whey are the foods that raise insulin the most. Is that right?
You cut out. Sorry.
Did I cut out? No worries. So you are saying that starches, milk and whey, and anything else that raises insulin the most.
Just sugar. So, this was the studies that I did. It was simply just eat all the calories, carbs, and fat you want. They did not have to count any calories, carbs, or fat. They just cut out these foods that spike insulin. So it was starches, it was milk, and whey protein, and it was sugar, and that was it. That's all they had to do, and it has been an absolute amazing results across all of the studies that we've done.
That is absolutely incredible, and I'm so excited to start incorporating that more into my work, because I focus more on blood sugar, and the reason I talk about blood sugar mostly is because people know a little bit more about blood sugar than they do about insulin, but I'm always sort of alluding at, like, we care about blood sugar because of what it's doing to insulin, and we can measure blood sugar more easily, and sometimes we can maybe infer what's happening, but all of these things are so, so important. So what do you feel that, and this is based on that comment that I first saw you write, what are people missing, or what are people getting wrong when it comes to blood sugar, because we're overlooking what's happening to insulin?
Well, I think, first of all, realizing that blood sugar is really just a symptom of insulin, high insulin levels, insulin resistance. And I'll go back to what you said about what we were talking about with whey protein. So, for example, if you go to Google right now and you Google whey protein and blood sugar, you will find plenty of articles that'll say, oh, whey protein is a great option for type 2 diabetics because it helps lower blood sugar. Well, yeah, because you're stimulating the pancreas to oversecrete insulin so that it'll bring that blood sugar down. Unfortunately, currently in the medical establishment, it is all about today's blood sugar, not about tomorrow's insulin resistance. So, for example, there's medications that they're not used too often now, thank goodness, but they used to be very commonly used, called sulfonylureas. So a sulfonylurea just forces that poor little pancreas to secrete every last bit of insulin it can, and the long-term side effects were, pancreatic cancer, weight gain, appetite, increased appetite, all the things that you would expect. And unfortunately, that's the problem, is that it's not always about today's blood sugar improvement. It's the worst part is more about tomorrow's insulin resistance. So, there are some accounts on Instagram, very popular accounts, that do recommend, if you add fat or protein to your potatoes, then you're going to have a lower blood glucose spike. Now, I want to explain why. So when you add fat and protein to starch, it causes a much higher insulin release. Well, obviously, and also, and this account posts a lot of times a specific article or a couple articles that support this idea of food combining, basically says this exact thing. It says when you add fat and protein to starch, it enhances the insulin secretion and prevents insulin clearance. Well, if you have more insulin in circulation, obviously you're going to have a lower blood glucose spike. That's just obvious. So yes, if you're wearing a continuous glucose monitor and you eat a potato, or you eat versus a potato with butter and cheese, the potato and butter with butter and cheese is obviously going to have a much lower blood glucose response because of the enormous insulin response that's in the background. And that is the problem. This is a much bigger problem than the glucose rise. And so I've had questions asked, well, so should I just accept the glucose rise or which one's worse? And I think the right recommendations, because I think what a lot of people are taking from these posts are that, because I've seen in the comment section, like again, where we shouldn't go, is, well, how do I add fat and protein to my ice cream? And if I do, is it making it healthier? Like, people are just thinking, well, if I'm going to eat my noodles, my white noodles, then it's okay as long as I'm adding meatballs to it. I mean, that's not the way you think about this. If you're going to eat noodles, eat them, enjoy them, and try to move on. Don't try to add something thinking that you're somehow making white noodles healthier, because that is not the case. It doesn't matter what your continuous glucose monitor says. And so I think the better recommendation is replacing those starchy and sugary carbs with non-starchy vegetables and fruit, not just eat your potato, but you have to eat butter and cheese with it. I mean, that's just, but sadly, you're going to see a very stark difference on your continuous glucose monitor, and everybody assumes lower blood sugar means better, so I'm going to keep doing this. But if only we could have a monitor for insulin, you'd see this enormous spike, just enormous in the background. And so I think it's more about focusing on what's happening behind the scenes. And I would love to develop an at-home insulin monitor, but I have a 4-year-old and a 1-year-old, and I just don't know if that's my journey right now.
Oh my gosh, I love that. And what you said is so, so helpful. And I think it goes back to the message that I'm trying to tell people and that you're trying to tell people, and is that if you are sick, if you have a chronic illness and you are trying to heal, you cannot escape the fact that there are certain foods that you are probably currently eating that are causing you to be stuck in that cycle of sickness, and that there's no way around removing or drastically reducing these foods for a period of time so that you can heal. So I'm sure if a person didn't have PCOS and they were really healthy and athletic, you wouldn't say to them, hey, never have rice because it has starch in it. It's about that individuality and the personalization that isn't able to be broadcast in one single Instagram post. But the idea that if you are in a healing phase, if you actively have acne and PCOS and you're missing your cycles, or you're overweight and your cholesterol's off the charts, or whatever it is, that lowering starches, milk, and added sugars are so, so important. And I've had so many people, like I posted, I don't know who needs to hear this, but oatmeal will probably spike your blood sugar. It's not a great breakfast. And people are like, well, I'm just going to put a scoop of protein powder with it and then I won't get a spike. Yeah. And it's so hard to for these people to unlearn and to re-educate, and they're seeing the blood sugar, but I personally don't always get that reduction in blood sugar either that is posted on some of these posts that we see on Instagram. I'm not always seeing that. So what I sometimes see is that if I have, let's say I have a steak and I have a whole sweet potato and maybe some greens or something, what I'll see is, because of the high amount of fat and protein in that meal, that I get a blood sugar spike. It's delayed, and then it's really long, and it takes a really long time to come down. And is that reduced insulin clearance that you were mentioning? It is that, but that is,
that fat and protein can sometimes help slow digestion, and it will slow the absorption of that also, that glucose. Yes. But that doesn't mean you're not going to absorb that glucose. Same thing goes with vinegar. I'm sorry.
Yes, talk about
I don't know who
please.
needs to hear this today, but just because you add vinegar before a plate of cookies doesn't mean that you've made those cookies healthier. That you just can't do that. Now, and before I get into how vinegar works, I think explaining, you're exactly right. I personally, I don't, if I go to a restaurant and I eat bread, I will just eat bread because I'm going to enjoy it right then, right? I'm at a restaurant, I'm going to enjoy it. But by no means am I going to say, well, I have to add butter to it because then it'll make it healthier. That's my thing, is if you want to eat a potato, savor it. Starches should be considered treats. By no means lie to yourself telling you that if you add fat or protein to it, it has now made it a healthier food. And that, I think, is what I hope to imply about this. Now, acetic acid, which is vinegar, can actually interfere with some of the enzymes in your digestive tract that break down starches into glucose. Well, that delays that glucose from getting into your bloodstream, but it doesn't mean you're not absorbing that glucose. It's not some magic thing that takes all the things you've eaten and flushes it out. You're going to absorb it. And when you do, all that glucose is going to need insulin and it's going to raise it. So that's the problem, is that, yes, originally right after you eat it, it might not look like this. It's just going to look like this. So you're still going to have higher insulin levels when you eat glucose-rich foods like starches, and adding acetic acid just gives you that immediate pleasure of thinking, oh, look at my continuous glucose monitor. It looks so beautiful. That's just not reality, and sadly. I mean, I wish that the secret to health was just a shot of vinegar and like adding some cheese to everything, because I would just be like right there.
I love that. And so, to put into words what you're saying, there's nothing that you can eat or consume before a meal that will erase any of the carbs or sugar that you're consuming. And I think that people are misinterpreting some of these posts as to, oh, this will erase the sugar. It will erase the blood sugar spike. And perhaps it does, not show a blood sugar spike because it has slowed that absorption, and then your insulin can work on it, but it's still in there. It's still, it's still required insulin. And so I think that's something that is so important to understand. And what would you say about someone I got this exact quote on Instagram. I posted something about a banana, and for me, bananas are, spike me a lot, and I know a lot of our personal variation and responses to food have a lot to do with a lot of different factors, including gut bacteria and all sorts of things. But what would you say to the person who said you can just eat a scoop of peanut butter before and then it won't impact your blood sugar? What are we seeing also with the fruits? Is it just any fruit is fine all the time for every person? What are the nuances? Because I know that there's nuance.
There is, and I think the best way to kind of explain this is to show, so this is really a lot of what I did my research in. So, when I did my first study, my pilot study, we had 24 patients. That's all the money that I had to pay. I could only pay for 24 patients. But I told them to follow this plan. Now, again, they could eat whatever fruit they wanted, as much as they wanted. I did not say anything about combine it. You can only eat bananas if you eat them with almonds. You have to eat a certain amount of protein. It was just all the animal protein. Lean is preferred, but it doesn't have to be. All the non-starchy vegetables, all the fruit, nuts and seeds, healthy oils, and I gave them a 6-ounce glass of red wine and an ounce of super dark chocolate every day too, because this was a lifestyle change. So if they wanted to drink some red wine, I wanted to know, what is this lifestyle change? So despite that they could eat as much fruit as they wanted, these were severely insulin resistant patients, by the way. They had a fasting insulin at baseline of 32. 32. And after 2 months, they had a 53% reduction. So even the fact that they were able to eat as much fruit as they wanted, they still had a 53% reduction in fasting insulin in 2 months, which is amazing. And so that's why I do remind is that starches, or that bananas as compared to other types of fruit, do have a little bit more starch in them. But overall, most fruit is, fructose and glucose, and that fructose really prevents so much of that insulin response, because people don't realize fructose is not metabolized the same way as glucose. Fructose, in small amounts, does not cause, it has a negligible effect on insulin. And so that's why, as long as they were removing the starches and the sugars, they could eat all the fruit they want. Most people aren't just going to sit there and binge on apples. It just really doesn't happen. So
I was a big acai bowl consumer. I loved acai bowls and smoothies, and I was living in Miami, Florida, and so I was over fruiting. I had
But acai bowls are sweetened, so they've got lots of honey in it. There are lots of sugar. So that's a. And smoothie
I was making
places,
my own, and they didn't. I was making my own, and because I love them so much, and I would blend it with bananas and put berries and things, and it was still, it's still a blood sugar bomb.
Yeah.
But I think that I hear what you're saying, that it is overall so much more helpful. And so, what about the fructose for these populations that probably have fatty liver? How do you see it impacting them?
So these were pretty sick patients. They had very high triglycerides, and high triglycerides is a great predictor of whether you're having high liver fat. So, the thing with liver fat accumulation is that it's when the liver gets overwhelmed with fructose. So if you go drink a soda, and it's straight fructose, straight into the bloodstream, going straight to the liver. Very, very different thing than eating an apple or a peach where you've got lots of water, lots of fiber. That fructose is small amounts. Like, I don't remember if I said it before, a small apple has about 5 grams of fructose. We're not talking about a lot. And so it doesn't overwhelm the liver. It's not causing stored liver fat. I don't remember. I think we had a 35% reduction in triglycerides in 2 months. And I mean, these patients weren't on metformin. They weren't even allowed to exercise. I did not allow them to exercise in our studies because in research, you have to be controlled. You have to know, what does the lifestyle change do, not what does exercise do. And so these were, I mean, no exercise, whatever, and they had a 30, I think it was 35% reduction in triglycerides. So again, they had an improvement in metabolically completely.
Okay, awesome. That's really exciting to hear. And yeah, I understand that the quantity really has a lot to do with it. And so
whole is the most important thing. Yes.
I was just going to ask you that. Yes, so not juiced, not like from this like green monster pre-made smoothie in the grocery store. Yeah, not even, and dried too is also something that really will spike you. So like dried mango. I used to, okay, this was my lunch when I had PCOS and I wonder why. So I would get sushi, which is such a huge spiker because of the rice, and they add sugar to the rice. Sushi spikes you like crazy, with a coconut water and dried mango.
Oh, yeah.
I was just
dried mango is like crack. Oh, it's so good. But yeah,
it is.
Oh, I used to love the dried mango that had the chili powder on it and the sugar. Oh, like
so good.
So much acne.
Yes, my acne was very related to my blood sugar spikes, my insulin. I'm so used to saying blood sugar because
it is.
Like,
it's hard.
I'm talking to like a basic audience, but it's because of the insulin spikes that I was getting the acne, and
people might not realize that. So what happens is when insulin spikes. Insulin actually can affect your sebaceous glands, so your sebaceous glands, which are under your skin, and which actually, because my cycle's starting tomorrow, I still get those around my cycle, and so actually insulin can cause your sebaceous glands to overreact, and so what that does is it produces more oil, it clogs your pores, all that oil then causes bacteria accumulation, and that's what's causing acne. So when you can actually lower insulin levels and lower testosterone, that is what is preventing that acne. So it's not necessarily the blood sugar spike. Again, you're right, it's the insulin spike. But it's just going to take so much time. Nobody can go to the store and buy an insulin monitor. So all they can do is monitor glucose, and that's what they're going to monitor. But I don't know if I told you this, so we recently, just last week, launched at-home insulin testing kits on our website. So I've been working with a lab the last year to help make this available because, and I always say, number one, you should ask your doctor, because if insurance is going to pay for it, you might as well go that direction. And then second is that if you want to go to like Quest Diagnostics, you can and go, but if it, you still have to show up there, or sit, they have to draw your blood. And this is something you can do at home. So we have fasting insulin kits, but we also have the whole full fasting in 2 hours. So they have a packet of dextrose where they can drink it. You wait 2 hours, you prick your finger, send it to the lab, and it'll give you your test. So at least for people who want to measure it and don't have access to somebody who will measure it, that's an option.
Yes, that's so exciting, and we'll have to link that below in the show notes for everyone. So is there anything that we haven't mentioned about how this low insulin lifestyle, which you defined as being low sugar, like no sugar, starch, or milk/whey, how does this, is there any other way that it differs from like keto, paleo? Is there any other sort of caveats or things to call out?
So, first thing, I think keto is great. Obviously, you're cutting out all those foods when you do keto. You're just cutting out fruit also. And obviously, it works great. Insulin levels plummet. Everybody feels better. They think it's because of ketosis, but it's really just because your insulin levels are lower and you can pull fat out of fat stores. It has nothing to do with ketosis. You don't have to be in ketosis to have, improvements, because the feeling that you're feeling, the better mental clarity, the better sleep, the better energy levels, less appetite, that is all just because your insulin levels are lower. And that's it. Now, you can reach that same goal without having to cut carbs to 20 grams per day. So that's the thing. You don't have to have that few of carbs to have the benefits of to reach a lower insulin level. And I guess that's what's important to know. So with paleo, I'd say this is kind of like a combination of the two, except for they don't have to count carbs. I think they ate like 100 carbs a day. They had to do food diaries. So they did eat quite a bit of vegetables. They did quite a bit of fruit. With paleo, there's like a lot of honey and agave nectar and a lot of sweet potatoes. And so that's like, if I look at some of the paleo cooking blogs and stuff, I'm like, I mean, it's all honey. Like, it's just a lot. So it's like sweet potatoes with honey on it. Like, that's not going to work.
Oh, why? That's when I developed PCOS and symptoms of PCOS and hypoglycemia and insulin resistance was when I did paleo, because I was adding all this. This is my theory, that I had finally embraced dietary fat because I thought it's like, oh, I was avoiding this my whole life and it's really healthy. And then I was leaning into these carbs and combining all the fat and the carbs together. Right. And so it was just this insulin storm.
Exactly. Yes. Exactly. Mm-hmm. So I don't dissuade anyone for being keto. If you can follow keto, I mean, I just think most people just can't sustain it because it's not really sustainable. I can't imagine counting anything. I count nothing. I do not count protein. I do not count fat. I do not count carbs. I eat these foods and I don't eat these foods, and I don't have to worry about food. And that's just, and the exercise part, exercise is extremely effective at lowering insulin levels. When you exercise, you can actually pull glucose out of the bloodstream without insulin, which means the pancreas says, hey, there's not as much glucose here. I don't need to make so much insulin. And the liver can start clearing it out of the system, which means insulin levels lower and you're better able to burn fat. Just is why you exercise, not because it burns calories. But on the flip side, if you're just going to exercise and follow that up with a whey protein shake, if you're insulin resistant, you're not going to, it's just, and I think that's another thing where people get so misinterpreted, like with whey protein. No, whey protein is actually a waste product. Did you know that?
Yeah, I did.
Yeah. And people don't know that. People don't realize that it is in our food supply simply because somebody had this great, really lucrative idea 60 years ago to take that and powder it and market it to fitness professionals and weight loss and sell it for $35 a tub. And so now we have, whey protein pancakes and waffles and muffins and all the things. And it's just like spiking insulin all day. So I think it's just a lot for people to have to relearn, and I get that, but thankfully I think that the movement is coming where people are learning more about insulin and less about realizing that blood sugar is just a symptom, a bigger problem.
Love that. So would you say to someone, let's use the fruit example, and let's use what do you think about naked carbs? So having just an apple by itself. What do you think about something like that? If we're talking about fruit, you do it all the time. Okay.
I don't buy into that because you don't. Okay. As long as you're eating these foods that don't spike insulin, they don't spike. Mm-hmm. You don't need to combine it with anything to make it healthier. You just don't. And so, and on the flip side of that is you can't combine a bread or white rice or whatever starch with something and make it healthier. I mean, if an apple is good just in and of itself, it's got water and fiber to slow that glucose absorption. So. I just don't.
Yeah. I have a bunch of people, and myself I would probably be from that hyper secretor perspective, that I feel that first off, it would make me really hungry. If I look at an apple and I just eat it by itself, it makes me feel like I'm starving. Because a couple of hours, an hour later, I would just feel really hungry. So would there be any negative effect of combining that with some sort of fat or protein?
No, not at all. Because remember, that fructose isn't really affecting insulin much anyways. And so I'd say if I do eat fruit, it's almost never by itself, but I've never once am like, oh, I can't eat this apple unless I eat a certain amount of fat with it. It's just...
Gotcha. Right. Yeah. And wouldn't the fat be worse than something like protein and fiber, which would maybe be a better choice? Or no, because it's just too much energy, and does it reduce the clearance too much of the insulin? Is it the fat doing that, or it's both protein and fat that does that?
That does it with starch?
Yeah. Oh, it's just.
It's really starch? Just with starch. It's really with glucose. Gotcha. Okay. And fructose is not as high in glucose as starch, because starch is just 100% glucose.
Gotcha.
So it's if you want to do that, I think it's great. Most people just naturally combine, don't eat fruit by itself, I'd say, but I don't. It just complicates things if you're like, oh, you can only eat this if you add it with that. If you feel better doing that, then absolutely. If you feel better eating less carbs, you should absolutely do that. If you feel like I'm not going to stick to this unless I can have, an orange every day, then by goodness, eat an orange. That's where it's more just, if you want to be a vegetarian, I can't imagine, I've been there, done that, was 40 pounds heavier, but if you want to be a vegetarian, do it, but don't think that you're somehow healthier eating tons of beans and rice, because you're definitely just not. And so there's a bunch of different ways to live a low insulin lifestyle, which is basically just saying there's many different ways to achieve improved metabolic health, and there's not just one size fits all. But it's pretty well established there are certain foods that are going to overwhelm your metabolism, and those largely are too much glucose, and that comes from starch.
Yeah, so helpful. And it makes me reflect on the advice that is given that you may have learned in school as when you were studying in undergrad, that you may be familiar with. For people with reactive hypoglycemia, they tell them eat protein and complex carbs every 2 hours. And this just, it's laughable to us because we understand the science. And people eat that and they're like, it's worse. Now I have to eat all the time. And it's just totally increasing the amount of insulin that they have in their system. And most often, not always though, that this reactive hypoglycemia is from too much insulin. I also get people where they're hypersensitive to insulin. Do you see this, or do you think it's just,
I mean, I would say though that is. So people that have reactive hypoglycemia are very sensitive to insulin, right? That's why it's driving it down. Other people, their insulin doesn't work at all. So they can oversecrete all day long and it's not going to do anything to their glucose because it just doesn't work. So does that make sense? I mean, you have a lot of different types of people. I think lean PCOS sometimes can be that way because they still have high insulin levels. If you compare them to somebody that's the same BMI that doesn't have PCOS, they still have higher insulin levels, but they're not as insulin resistant. So sometimes you could see that too. But you're right. Some people are more sensitive to insulin, and others could make buckets of it and it have, this is a great example. One of the women in our study, we took her blood. And this was in a lab, this was a hospital lab. This was one of our at-home kits. And so we could do it again. So we took her blood and her fasting insulin her 2-hour insulin was over 1,000. It needs to be less than 50, her 2-hour insulin. So we thought it was a lab error. We're like, there's no way. There's no way. We did it again. The same thing. It actually just said over 1,000. It was beyond the cutoff. And she was perfectly fine sitting there, had no idea. So some people make so much, their pancreas is just nonstop all the time and have never experienced a hypoglycemic episode in their life because so I think that's why I think that's important to know that. And that's why this is not a diet. I feel like people that follow me are probably I'm tired of hearing about a low insulin lifestyle, but it's really just about prioritizing lowering insulin levels in any way that works for you. And some people, it works by being 100% carnivore. And some people, it works by just, having a little bit of fruit every once in a while or whatever, or being a vegetarian. There's just so many different ways. But if you're focusing on blood sugar and doing whatever it is to get a lower blood sugar, you're missing
the forest for the trees.
Yes, absolutely.
Yeah. And I'm trying to explain that more in my content because you can sort of capture people by this, but that idea of lower it by any means necessary is just what the mainstream is doing with type 2 diabetics. It's not lower it by any means necessary because sometimes that means more insulin and we don't want that. So
so after I did my first study, I went on and did this what's called a metabolic study, and I don't know if we're almost short of time, so I'll be quick, but so
keep going. This could be as long as you need, as long as you can do it.
So, we did this study. We had these 24 patients. I got this grant from the Laura W. Bush Women's Health Research Institute and did this study. It was amazing. So then I went and did another study, and it was a metabolic study. So when I say metabolic, we only had 10 patients, but you'll see why. It was extremely labor intensive. So we put them in what's called a metabolic cart. And I don't know if you've heard of this, but it basically it measures how much carbon dioxide they breathe out to how much oxygen they breathe in, and it gives you a ratio. Now, people don't realize this. That ratio will tell you, are you burning fat or are you burning carbs for energy? So these patients came in after fasting. It was 4 or 5 o'clock in the morning. We took their fasting measurements of this. Well, you would think if they've been fasting all night, they should be burning mostly fat, right? No, burning almost all carbohydrate. So it gives you the ratio, and the ratio tells you if they're burning fat or carbs. Then after that, we gave them this very high-fat shake, which was basically just an Ensure that we added butter to. And they drank this shake, and then we measured that for 5 hours after the shake, because we wanted to know, if you're insulin resistant, how do you metabolize the fat in the food that you're eating? Does that make sense?
Yes.
Insulin levels are too high, you can't burn fat. Well, that's exactly what happened. They drink this high-fat shake. They immediately, you can show that the amount of grams of fat they're burning plummets. All they did was burn the sugar, and the Ensure stored all the rest of the fat as fat over the 5 hours. So after this 8-week study, again, all they did was cut out starches, milk, whey protein, and sugar, and they ate whatever else they wanted. No exercise, no metformin, no spironolactone. They came in afterwards, at fasting, almost all fat. They drank the high-fat shake, almost burning almost all fat. I mean, it was absolutely amazing. I mean, that's the research that got me the NIH postdoc, so that's the reason I was able to get to do that. And so, went and did that postdoc. Well, so after that study, these reproductive endocrinologists who were referring their patients into the study, they were like, these patients are all coming back pregnant. They've been trying to get pregnant for years. They're just ovulating now. And so they wrote that as a case series. And then after that, they were like, we'd actually like to do this and see if we can replicate this as a randomized control trial. So this is what I think is the most interesting. So I wasn't actually involved in this study, which I think is good because you need to have independent researchers replicate results. They just used kind of the lifestyle plan that I had used for the previous research studies. And so it was 2 reproductive endocrinologists and an OBGYN and a couple of residents. And so what they did is they had 3 groups of patients. They did randomized controlled compared to metformin and standard of care. So standard of care is like your NIH, more starch, more low-fat dairy, like all the things. And the other 2 groups one was just, they watched a 10-minute video to teach them how to follow a low insulin lifestyle. And the other one got a face-to-face visit with a dietitian on how to follow a low insulin lifestyle. So that makes sense. You had 3 groups. We wanted to know, or they wanted to know, do we have to give every patient a dietitian, or can they just watch this video for 10 minutes and still have a benefit? And so here's what happens to insulin levels. Now, the manuscript is being worked on. They presented it at ASRM, which is the big fertility conference. Got an oral, got a prize poster. We're super excited.
Yay, congrats.
Because that's what everybody does is they get metformin and they're like, follow this plan. And they come back 2 months later and they're usually, have gained weight. And that's exactly what happened. So their insulin levels went up, even though they're on metformin. Their insulin levels went up, not hugely, but a point. The group and they gained 1/3 of a pound. And the group that was face-to-face lost 17.3 pounds in 2 months, which is very similar to what I found in the previous studies. 19 pounds in my first study, 18 pounds in my second study, and then this study they lost 17 and a half, so it's replicated, and had I think it was a 15-point drop in insulin levels. I mean, so we're looking at huge numbers compared to metformin. So that, and especially using a randomized controlled trial, that's what's really important. And so, and it's not just in, somewhat insulin resistant patients. I mean, I think this one, the average insulin fasting was 29. So, I mean, which is insanely high. I mean, so we're looking at very insulin resistant patients. So, so it really does work if you really focus on lowering the insulin. Really, almost everything else takes care of itself, and that's why people on keto just feel so great.
Yeah, amazing. I feel so excited. I just feel like I just unlocked, I don't know, a secret passage to a treasure chest. I feel so excited with this information because I want to find a way to really infuse it into what I'm teaching, adjust some things that I'm teaching to get people better results faster. And it's amazing that these people are dropping weight, their triglycerides are going down, their cholesterol's improving, their insulin's going down. That idea that high insulin blocks us from burning fat. I mean,
Yes.
so many people, I always talk about, like, if you have excess fat on your body and you have no energy, it's an access problem. What is
Yes.
blocking this access to burning your fat, which is stored energy, is insulin. And so if we can get that down, what other factors lower insulin? You talked about exercise, we talked about the foods. What else can we do to help lower insulin?
You can do inositol. There's good data on that, but you have to remember that it is only a tool, and it is only number 3 on that. It may be number 4 on that list. I think number 3 is stress. It is improving your stress. I'd say improving your sleep, but insulin resistance causes sleep issues. So you got to focus on one before the other is going to improve.
Yeah.
But number 1, you've got to change your diet. Number 2, then you can exercise. You put exercise first and don't change your diet, you're not going to see the same thing. First, change your diet. Second, start doing exercise. Exercise like walking, strength training, occasional bursts of high intensity, not going on a 6-mile run. All that's going to do is raise cortisol. It's going to make it worse. Third is going to be stress, manage your stress. And then fourth would be inositol. And you know what? You don't even need it, really. If you want to do it, that's great. It'd be great to do a study one day to have them follow this and do inositol and see how much better they did. But they did so amazing in 2 months that maybe they don't even need to spend $80 on inositol supplements. So I would say those 4 things.
And what about, do you find time-restricted eating helpful, like an early cutoff for dinner helpful? Are you tracking those things with your patients?
Intermittent fasting is obviously great. And, longer is not always better. There is, but if you don't want to do that, you don't have to. If you love doing it, the more the great. It's I wouldn't say the more the better, but all the better. I think, again, it's all what fits into your lifestyle. If you don't like breakfast anyways, by goodness, don't make yourself eat it just because you like it, or just because you feel like you have to.
Yeah, I personally do not recommend a skip breakfast for fasting, especially for women, because what I find is that it does work initially, but over time it drives a lot of cortisol, adrenal issues, and we get it really disrupts the circadian rhythm, and then it also causes us to backload all of our calories. So then we're eating 12 to 8 when we could have been eating 8 o'clock in the morning to 4 p.m. and then we have that nice overnight fast when we would have been fasting anyway. It's supportive of better sleep, all those things. So I talk to people about how the number of times you're putting something in your mouth that has calories in a day, that matters too, because every time you have something, you're going to get this little bump of insulin unless you're just eating a bite of butter, which we don't do that. So, so not eating as often is really helpful. So that's where that building a plate that has a good amount of protein. I say eat your protein until you cannot take another bite of protein, because we want to get that in. It's so satiating for our bodies, and it's so regulating for the appetite. And then eat the other things, and then you'll probably be able to make it to your next meal without eating, unless you have reactive hypoglycemia, and if that's the case, come see me. Right.
For sure. I think so many different things work for so many different people, and I think if you're following those first 4, really find what works for you. I love breakfast. I could never not eat breakfast. I'm just a breakfast person, but I can take or leave dinner some days. And so that is, I tend to do that sometimes, especially when I'm lazy and don't want to eat, or, I don't want to make something, or I'm full because I ate lunch at 3 o'clock. So I think, but I don't ever eat if I'm not hungry, but I'm almost always hungry at breakfast. But
that's a good sign.
I just think it's just more about finding what works for you. But for the most part, eating those foods that spike insulin is what makes most people not feel well.
Amazing. So helpful. And I'm so thankful that the Instagram gods brought us together. Yeah. And so tell people where they can find you, and I will make sure to link below to everything in the show notes.
Absolutely. Well, I am on Instagram. I just started maybe 6 months ago. So I do post quite a bit of content there. And then I have a website. It's called Lilli Health. So Lilli is an acronym for Low Insulin Lifestyle. And so that has a lot of information and blogs, and we have newsletters. We have one newsletter that goes out to consumers and patients, and we have one that goes to healthcare providers so that they can help link their patients to some evidence-based information. And then we're coming out with an app soon. So hopefully the app will have tons of free education. I got a grant from the National Science Foundation from all this research. And so they have really helped us launch this so we can make education free. So if they want to track their symptoms, and they have meal planning and recipes and all that. Okay, so then we also have our insulin testing kits. If you want to get started and want to find out where you're at, that's something you can do. And I wrote a book about my own personal PCOS journey, but then also all the, the science behind this way of eating and the research I've done. So I think that's pretty much wraps that up, but usually the website's probably a good place to go.
Perfect. Thank you so much for being here. Thanks for taking your time. And I'm so, so thankful that you are doing the work that you're doing, putting it out into the world and helping clarify some misinformation or some unhelpful information that's really being spread out there. And so we'll try to tackle it one person at a time. So,
well, I appreciate you too, using your platform to, get the right word out there.
Yeah. Thanks, Allie.
Thanks.